Hello, you're welcome. My name is Dr. Chris Williams, and I'm your host on Well Again. Well Again is your online health magazine program in which we look at fail-proof principles for regaining health and retaining health. You are welcome. All right. I want to create a sub channel of some sort under Well Again, and I want to call it complementary fertility. Complementary fertility. Under it, I'll be talking a lot about how to use both the orthodox and the natural or alternative approaches, combining the two to be able to achieve pregnancies and to also have children. All right, this is important because a lot of the calls I get, a lot of the contacts I get are people who are battling with children, with wanting to get pregnant one way or the other. Now, maybe we should, so the title of this one is subfertility. Subfertility. Some people choose to call it infertility, but one of my mentors calls it subfertility because he thinks infertility is a bit on the totalitarian side. It's like it's final. Okay, subfertility gives us a better sense of that it can change, and it can really change because nothing cannot change. Okay, there's no family that cannot carry their own baby. Okay, so if I say subfertility, I'm referring to infertility, and if I call it infertility, just know that it's because I am used to that. I'll try to stick with subfertility. Now, what is subfertility? Subfertility is when a couple have been sleeping together, that is making love, having unprotected sex, using no contraception at all, and they're doing it at least 3 times a week, and yet in 6 months they have not been able to achieve a pregnancy. I'll say it again. A couple has been sleeping together thrice a week, unprotected sex, using no contraception whatsoever, the man or the woman, and then of course it's taking place at the roundabout the ovulation period, the right time, the ovulation window of the woman. If this has continued for 6 months and they have not been able to get pregnant, we call it subfertility. Okay, some people choose 12 months, and they say it's that's when it should be called subfertility or infertility. Whichever way it goes, between 6 to 12 months, a couple have been having regular unprotected sex around ovulation, thrice a week. They are not using contraception, and they have not been able to get pregnant. Then we say they are dealing with subfertility or infertility. Now, what are the causes? The causes are numerous. But the first one is maternal age. Maternal age. Okay. There's something called fertility window. The fertility window of a woman is broad, but then it is best round about between 20 and 24. Okay, very, very important. Okay, by the time a woman has reached 25, that kind of woman, if she's exposed to the types of sex we have talked about, unprotected, no contraception, adequate sex, there's 60% chances that she will get pregnant in the first 6 months, and 85% chances that she will get pregnant in the first 12 months. Okay, so women who are 25 years old and down get pregnant about 60% chances in 6 months, and 85% chances in 12 months. Okay, So maternal age matters a lot. Now, by the time the woman is 35 years old, her chances of getting pregnant in the first 6 months reduces drastically. As a matter of fact, in the first 12 months, her chances are only 60%. Remember, we said for the woman who is about 25, her chances are about 85% in 12 months. For a woman who is between 25 and 30, 25 and 30, our chances are about 60% in 12 months, and it will take 24 months to be able to get about 85% chances. So of course, when the woman is older than 35, then the fecundity is reproducibility reduces even further. So by the time a woman gets to 40, for instance, the chances of getting pregnant unaided really reduce drastically. Okay, so maternal age is a first cause. Paternal age is another cause. Okay, and paternal age, for men, their fertility begins to drop sharply round about 40. Okay, round about 40 it begins to drop sharply. While for the woman, the fertility begins to drop round about 24. For the man, it's round about 40. Okay, so maternal age matters. Paternal age matters, and then the timing and the adequacy of intimacy or sex does matter also. If they are not meeting around ovulation, okay, it's only sex that is done 2 days prior ovulation. No, let's put it this way: 4 days to ovulation, 2 days to ovulation, and then 1-2 days after ovulation. Those are the sexes that can, those are the intimacies, the coitus that can result in pregnancy. I'll say it again. For a woman to get pregnant, she has to meet with her husband within a 4-day window to her ovulation, and then max maybe 1 day after ovulation. Okay, every other sex that that woman is exposed to in the course of the month does not lead and cannot lead to pregnancy. The reason is that at ovulation, what is ovulation? Ovulation is releasing of the eggs. Okay, releasing of the eggs. A woman releases has multiple eggs in her body. We are going to talk about it later. And then round about the middle of her month, if she has a 28-day cycle, round about the 14th day, if she has a 24-day cycle, round about the 11th and the 12th day, she releases the eggs. The ovaries release an egg, and then the fingers of the tubes, called the fimbria, will pick the egg literally, and then through peristaltic movement, it will be pushed towards the uterus. Now, it takes for the egg to be fertilized, the sperm has to have started its journey 3 days earlier. It takes about 3 days for the sperm to swim from where it is deposited in the vagina to the point where it meets the egg to fertilize it. 3 days. That's why if a woman needs to get pregnant, she has to have sex between round about 4 days to her ovulation or 3 days to her ovulation. It's so very important. So that's what we call right timing. If it is not timed like that, they are going to the chances of getting pregnant, we never say never in medicine, reduces most drastically. So, and then if this woman is not having sex regularly, maybe there are some people, they live in Abuja, their wife lives in Lagos, or they're in US, their wife is in Nigeria, and they meet only 3 times a week. All those kinds of things reduce add to the causes of infertility a whole lot. All right, another cause for subfertility or infertility, as some people would choose to call it, is the duration that the people have been trying to get pregnant. Okay, if a couple doesn't get pregnant in the first 6 months, it adds to it, because the couple come under anxiety, the stress. There's increased psychological stress both in the man and more so in the woman, and stress any day, anytime reduces a woman's fecundity, reduces a woman's fertility. So the longer they have been waiting, the more the stress, and then that it becomes like a recurring decimal, and that in addition further worsens the woman's fertility. Also, previous contraception, and this is very important, previous contraception can also affect a woman's fertility very well, especially when a couple's fertility, not only the woman, especially when the contraception has gone on for a very long time. They did a study and they found out that there's something called TTP, time to pregnancy, time to get pregnant. Now, for people who have been using condom for a long time, the time to get pregnant, that's after they stop using the condom and they decide to start they decide to get pregnant. Okay, if they stop using condom in February and they decide to get pregnant, they found that sometimes it can take up to like 4 months, 4.6 months. Okay, they did a study, and then if the woman was using oral contraception and she stops today, most women will not get pregnant till about 7 months time, because that oral contraception literally disarranges, let's put it that way, not rearrange, it disarranges the body's hormonal balance, and it takes that long a time for it to come to normal, that if ever does come to normal. Okay, for women who use IUD is intrauterine device, that's the copper T that people use. It takes about 7.5 months from the time they remove the IUD to the time to get pregnant. It takes about 7.5 months. And for women who are using injectables, that's Depo-Provera, the one they put under, the one they call injection, that they put under either a monthly load, or this one they put under here. By the time they have stopped the injection, or by the time they have removed the one they put under the skin, it takes about 13.6 months. That's well over a year for some of them to even begin to get pregnant. For many others, their fertility never returns to normal again. So it's so important that so contraception, maybe this is why Catholic talks a lot against contraception. All right, but even if you must do contraception, I've always talked about it. Do not use oral contraceptions. Don't use oral contraceptions. Do with condom, or you just calculate your period. Okay, you calculate it. All right. So that is that. Now, some other things that contribute to infertility is occupational hazards, people's occupations, and it affects women, but it affects men the most. Okay, there's a substance, a chemical called nitrous oxide, and I think they use it in textile industries and all that. People who are exposed to it, especially women who are exposed to it, they are quick to develop infertility. Okay, some other chemicals that can destroy fertility are heavy metals like arsenic, like cadmium, like mercury, like lead, and this affects the quality of men's sperm the more. Okay, so cadmium, arsenic, mercury, lead, and all that. Okay, so occupational hazards. Also, for instance, if a man is a driver and he drives almost all day, that's sitting, because the testes The reason God makes sure that the testis is in the scrotum outside the body is because it needs to be cool. It needs to be cool. The testis needs to be cooler than the body temperature. So when a man's testis is short, that is too attached to the body's temperature, it can lead to infertility. Or when a man does a job that always makes them sit down and their testis is just trapped there, or when they wear tight things like nylon pants and all that, making that place heat up, it's not good for the testes at all. That's why some doctors recommend that you wear loose boxers, very important, and then learn to sit. People who sit with their legs crouched, little by little, they may be destroying their testes. Also, men who are drivers, especially in our part of the world, you see some of these commuter drivers, the commuter buses they are driving are so hot, some of their engines are right behind them. Those kinds of things kill the testes. Okay, so and the testes begin to not be able to produce good quality sperms. Okay, diet also. Diet has a large contribution, very large contribution to fertility. Diet contributes a whole lot to fertility. All right. So lifestyle and stress also, we have mentioned it. People who eat anyhow, they eat all this food we call junk foods, plenty of animal fats, plenty of junk foods, flavorings, colorings, sweets, sugary things and all that. Wheat and flour. Wheat contains gluten, and gluten is notorious for destroying fertility. Gluten is notorious for destroying fertility. Okay, so both in the man and the woman, I'm going to stop here so far. Make sure you see the second edition of this, the second edition of this title. All right, because we don't want these videos to be too long. We're stopping here so far. See you.